Pennsylvania Senator John Fetterman has checked him in to rehab for clinical depression. Last year, he suffered a stroke mid-campaign due to complications related to a heart condition. Then, in his first debate, he seemed to struggle. His ability to think and speak seemed off. Those questions were shouted down as bias. Last week, he made headlines for entering the hospital again for lightheadedness. And again, today, he checked himself into Walter Reed Hospital. This is very interesting. The way I wrote this was not for his physical health, but for his mental health. Stupid, playing into the stigma. You see, even though I want to be an advocate for change, I can't break out because we're just programmed to see it as different. You see what I'm saying? And that's the problem that I don't want to exacerbate on this show, but I do want to talk about what it means for his ability to serve. Let's bring in licensed clinical social worker, Dr. Darcy Sterling. Darcy, I didn't allow you that one easy slap at me right off the top. I don't care whether it's his kidneys or his conscience that is causing him pain. It's about what it means for his overall fitness, whether it's, heart, liver, kidney, depression, bipolar, whatever it is. So help us understand, what does it mean that someone who had a stroke is also struggling from depression? Is that unusual?
No, it's super common, Chris. 1 out of 3 people who are recovering from a stroke find themselves struggling with depression as well. And the good news is that it's super treatable when it is connected to a stroke. Now, what we know about Fetterman is he has struggled with depression on and off his whole life. My guess is, and again, it's just a guess because nobody's spoken to him, my guess is that he knows that he's having to struggle and he's made the decision to be aggressive in the treatment. And you can do that much more aggressively inpatient than you can outpatient. What could take, weeks or months on an outpatient, months for sure on an outpatient basis, can potentially be condensed to weeks inpatient. They can be much more aggressive with their medications.
Am I wrong to say, though, that when most people are dealing with depression, they don't do inpatient?
No, you're not wrong, but most people ignore all their needs. Most people push through their needs. That's what our society is all based on. We are encouraged and rewarded for ignoring pain. So I'm guessing he knows himself well enough. He knows the warning signs. He knows that this is a big struggle. I can't even fathom what the amount of stress and frustration that someone our age who's been operating and functioning at one level his entire life suddenly has to accept all these accommodations at the same time that he's in a fishbowl in the Senate, brand new job. I can't even imagine the strain that must have put on him.
All right, fair point, but two things can be true at once. Two things can be true at once, Doc. Look, everything you just said can be completely right. But also, it can also mean that maybe forget about fitness, this isn't the right fit. So when is that a fair question to ask of this senator about what he's dealing with? When is it a fair question? What is the standard for when you have to start asking whether or not what he's dealing with makes him incapable of dealing with what he needs to do for his constituents?
The very fact that he voluntarily admitted himself inpatient for depression tells me that he's got his eye on this thing and that he is going to manage it appropriately. I think that that's a question for Fetterman and his treatment team. And, I think he's throwing as much mud against the walls as he can, as rapidly as he can, to get this thing under control so that he can come back and function the way he needs to function. But that's not a question for speculators to imagine or ponder. That's really a question for him and his treatment team. The doctor who suggested that he go inpatient expects that he will be able to get this under control. So we have I didn't examine him, neither did you. We have to just wait and see what happens.
Hey, thank you for watching. Please go to newsnationnow.com, newsnationnow.com, and you can find NewsNation on your television provider. And Don't forget to click the red subscribe button down below. Then you will get more of NewsNation's fact-driven coverage.